Welcome to G Fun Facts Online. Let us dive straight into a reality that has aggressively breached our daily lives. The intersection of climate change and public health is no longer a distant, theoretical scenario reserved for the closing chapters of scientific reports. It has transformed into a global health emergency that is currently reshaping how we live, how long we live, and how we die. With 2024 confirmed as the hottest year on human record, and subsequent years continuing the relentless warming trend, the narrative of climate change has fundamentally shifted. We are no longer just talking about shrinking ice caps and struggling polar bears. We are talking about overcrowded emergency rooms, collapsing agricultural systems, and the relentless, borderless spread of infectious diseases. Yet, this crisis is profoundly undemocratic. While the changing climate spans the entire globe, its health impacts do not strike equally. The severity of the blow is heavily mediated by two critical dimensions: socioeconomics and geography. Where you happen to be born, the elevation of your city, the proximity of your home to a coastline, and the balance of your bank account are now the primary determinants of your physical resilience against a warming world. To truly understand this modern public health crisis, we must view it through the dual lenses of the geographic lottery and the socioeconomic divide. But before dissecting the inequalities of this crisis, we must first understand the sheer breadth of the physiological threats posed by a warming planet. The human body is a highly calibrated machine. It was designed by evolution to operate within a very narrow thermal and environmental window. Climate change forces the body to adapt to conditions it was simply never prepared to endure. Let us start with the silent and immediate killer: extreme heat. While dramatic natural disasters like hurricanes and catastrophic floods capture global news headlines, extreme heat is a silent killer that claims vastly more lives year after year. To give you a sense of scale, in 2022 and 2023 combined, more than 100,000 people across 35 countries in the European region died due to heat-related complications. But what exactly happens to the human body when the temperature spikes? When ambient temperatures exceed the body's core temperature, your cardiovascular system goes into absolute overdrive. Your heart pumps aggressively, attempting to push blood away from your internal organs and out to the skin's surface to release heat through sweat. For a healthy adult, this is exhausting. But for the elderly, for infants, or for those with pre-existing cardiovascular and respiratory conditions, this intense physiological strain can trigger fatal heart attacks or strokes. Furthermore, chronic exposure to high temperatures combined with physical exertion is creating entirely new medical epidemics. This is a daily reality for millions of agricultural and construction workers globally. Medical professionals have linked this relentless dehydration and heat stress to an epidemic of chronic kidney disease of unknown etiology. Day after day, the severe heat literally destroys renal function over time. According to recent World Health Organization data, approximately 37% of all heat-related deaths are directly attributable to human-induced climate change. Even more alarming, heat-related mortality among individuals over 65 has risen by an astonishing 70% over just the last 2 decades. But heat is only one part of the anatomy of this emergency. We must also look at the expanding empire of vector-borne diseases. The geographic boundaries that once contained deadly diseases are dissolving right before our eyes. Vectors like mosquitoes and ticks are highly sensitive to temperature and humidity. As global temperatures soar and rainfall patterns become wildly erratic, the habitats suitable for the Aedes aegypti and Anopheles mosquitoes are expanding. They are moving poleward, and they are climbing into higher altitudes that were previously shielded by cooler climates. The recent explosion of dengue fever perfectly illustrates this terrifying trend. The global average transmission potential of dengue has surged by up to 49% since the 1950s. Why? Because warmer temperatures act like an incubator on fast forward. The heat accelerates the mosquito's life cycle, and crucially, it accelerates the viral replication rates inside the insect. Driven by these soaring temperatures, dengue spread to roughly 1 in every 800 people on the planet in the early months of 2024 alone. In the Americas, climate change has been identified as a primary driving factor behind a record-breaking surge of approximately 45 million dengue infections in a single year. The tragic reality is that public health infrastructure in regions newly exposed to these pathogens is often caught entirely off guard. They lack the diagnostic tools, the specialized treatments, and the rigorous vector control protocols that traditionally endemic regions have spent decades developing. Beyond diseases, the climate crisis is systematically dismantling the fundamental building blocks of human health: clean air, safe water, and adequate food. Rising temperatures and prolonged droughts have turned vast swaths of global forests into massive tinderboxes. When these ignite, the resulting wildfires produce astronomical quantities of fine particulate matter, known as PM 2.5. These microscopic particles are so small they can travel thousands of miles on wind currents. When inhaled, they bypass the body's natural defenses, penetrating deep into the alveolar sacs of the lungs and passing directly into the bloodstream, triggering systemic inflammation. In 2024, an estimated 154,000 deaths were linked directly to wildfire smoke-derived small particulate matter. Simultaneously, erratic precipitation leads to catastrophic flooding. These floods routinely overwhelm municipal sanitation systems, washing raw sewage into streets and contaminating drinking water supplies. In Africa, changing weather patterns and sudden flash floods recently contributed to a massive surge in waterborne diseases. The Africa CDC recorded over 300,000 cholera cases by late 2025, a stark reminder of how quickly water can turn from a source of life into a vector of death. This brings us to the concept of the geographical lottery. In the era of climate change, geography is destiny. The specific topography, latitude, and regional climate of your home dictate the precise nature of the health threats you will endure. Consider coastal communities and small island developing states. For the billions living in these regions, sea level rise represents an existential threat that extends far beyond the loss of valuable real estate. As oceans rise, heavy salt water intrudes into underground freshwater aquifers. This severely compromises drinking water supplies and destroys fertile agricultural land. Consuming highly salinized water is not just unpleasant, it is biologically dangerous. It is directly linked to hypertensive disorders. This is particularly dangerous for pregnant women, leading to severe complications like preeclampsia and premature births. Furthermore, coastal communities are the first line of defense against increasingly intense tropical cyclones and hurricanes. These superstorms decimate local health infrastructure, sever global supply chains for essential medicines, and leave vast pools of stagnant water in their wake, creating the absolute perfect breeding ground for cholera and malaria outbreaks. Now, let us shift our focus inland to the cities. More than half of the global population resides in urban centers, and these concrete jungles present a unique micro-geographical hazard known as the urban heat island effect. Cities are largely composed of asphalt, concrete, and steel. These materials are exceptional at absorbing and re-radiating solar heat. Combined with a severe lack of natural vegetation and the massive amounts of waste heat generated by millions of vehicles and air conditioning units, urban areas can be several degrees hotter than their rural surroundings. This effect turns cities into thermal traps during heat waves. Urban populations face a disproportionately higher risk of heat stroke. Furthermore, the intense heat bakes vehicle exhaust, exacerbating ground-level ozone pollution and triggering severe respiratory distress. In arid and semi-arid regions, such as the Sahel in Africa or parts of the Middle East, the crisis manifests primarily as drought and aggressive desertification. The health impacts here are insidious and slow-moving: chronic water scarcity, catastrophic crop failures that lead to severe, widespread malnutrition, and a massive increase in respiratory diseases caused by apocalyptic dust storms. Conversely, temperate regions that historically enjoyed mild climates, like much of Europe, are now experiencing what scientists call the tropicalization of their weather patterns. European countries are actually warming faster than any other World Health Organization region. They are finding their populations uniquely vulnerable simply because their architectural and public health infrastructures were never designed to withstand extreme sustained heat. Homes were built to retain heat for harsh winters, not to vent it during unprecedented summer scorchers. If geography dictates the nature of the climate health threat, socioeconomics dictates a population's ability to survive it. Climate change acts as a brutal, unforgiving magnifying glass. It exposes and violently exacerbates existing structural inequalities. Simply put, the wealthy have the capital to purchase adaptation. The poor are left entirely exposed to the elements. We call this the wealth shield. Affluence literally buys distance from environmental disaster. High-income individuals can afford robust, centralized air conditioning to easily survive extreme heat waves. They can purchase advanced HEPA air purifiers to filter out toxic wildfire smoke from their living rooms. They can secure comprehensive health insurance to treat any climate-related ailments. And ultimately, they possess the financial mobility to simply pack up and relocate when their geography becomes uninhabitable. For marginalized and low-income populations, this wealth shield simply does not exist. Vulnerable communities are often geographically relegated to areas with the highest environmental risks. They live in low-lying floodplains. They live in what we call fence-line communities, situated right next to heavily polluting industrial facilities. They live in densely packed, highly paved urban neighborhoods, entirely devoid of cooling tree canopies. In the United States, historical discriminatory practices like redlining have left minority neighborhoods with significantly less green space. Today, this means these exact same areas experience significantly higher temperatures during heat waves compared to affluent, tree-lined suburbs just a few miles away. Furthermore, the sheer economic imperative to work traps millions in hazardous environments. Think of the outdoor laborers, the agricultural workers harvesting our food, the construction crews building our cities, and the delivery personnel bringing goods to our doors. They cannot simply seek refuge indoors when temperatures soar to lethal levels. They bear the absolute brunt of thermal extremes, sacrificing their immediate and long-term health just to maintain their livelihoods. Ironically, their labor upholds the very societal infrastructure that allows the wealthy to remain comfortable indoors. On a macro level, this socioeconomic divide is starkly visible when we compare the global north and the global south. Low and middle-income countries, which have historically contributed the absolute least to global greenhouse gas emissions, are suffering the most severe, devastating health consequences. These nations often struggle with historically underfunded health systems, high baseline rates of poverty, and a critical lack of resilient, modern infrastructure. The financial cost of this injustice is staggering to comprehend. The World Bank estimates that a changing climate could lead to excess health costs in low and middle-income countries of at least $21 trillion by the year 2050. That massive sum would eat up approximately 1.3% of their projected gross domestic product. Furthermore, the compounding effects of climate-driven health crises are deeply destructive to personal wealth. Lost labor productivity due to extreme heat, combined with the catastrophic medical costs associated with unexpected events like a sudden malaria outbreak, are expected to drive at least 44 million people into extreme poverty by the year 2030. When a climate disaster strikes a developing nation, the healthcare system itself is often a direct casualty. Raging floods wash away rural clinics, vital power grids fail, supply chains for life-saving medications rupture completely. Without robust, immediate international support, these nations are forced into a vicious, unending cycle of disaster and delayed recovery, permanently stunting their economic and social development. So how do we fight back? Addressing this climate-driven public health crisis requires moving far beyond mere acknowledgement. It requires investing heavily in targeted adaptation, innovative technologies, and systemic global equity. If climate change is the ultimate threat multiplier, our response must be a resilience multiplier. One of the most promising frontiers in climate health adaptation is the integration of artificial intelligence and advanced epidemiological forecasting. Rather than passively waiting for an outbreak or a lethal heat wave to claim lives, forward-thinking nations are using massive datasets to anticipate the crisis before it strikes. In India, for example, the indigenous Bharat forecasting system utilizes powerful AI to offer high-resolution predictions down to a 6-kilometer radius. It combines complex satellite imagery of land surface temperatures with granular socioeconomic data to identify the most vulnerable urban heat islands in absolute real time. Similarly, predictive vector-borne disease modeling is fundamentally transforming public health from a reactive discipline into a highly proactive one. By analyzing complex, nonlinear climatic variables such as shifting humidity levels, stagnant water accumulation patterns, and micro-temperature fluctuations, AI models are changing the game. Systems utilizing random forest and long short-term memory machine learning, like those deployed in Kerala, India, can accurately predict massive dengue and malaria outbreaks weeks before the first patient ever visits a clinic. This vital lead time allows public health officials to pre-position medical resources, issue hyperlocal public alerts, and implement aggressive larval control measures precisely where and when they are needed most. But digital adaptation is not enough. Adaptation must also take a highly physical form. We must engage in greening the infrastructure. Our cities must be radically redesigned to mitigate the urban heat island effect, focusing heavily on implementing green infrastructure in those historically marginalized, low-income neighborhoods we discussed earlier. Expanding urban tree canopies, constructing accessible community cooling centers, utilizing highly reflective building materials on roofs and roads, and integrating functional urban wetlands can dramatically lower ambient city temperatures and safely manage violent floodwaters. Simultaneously, healthcare systems themselves must undergo a radical top-to-bottom transformation. Hospitals must become fortress-like in their climate resilience. They must be equipped with independent, renewable energy microgrids to ensure that life-saving machinery, like ventilators and dialysis machines, continues operating flawlessly during catastrophic regional grid failures. Healthcare systems must also look inward and address their own massive carbon footprints. Ironically, the global healthcare sector is a massive emitter of greenhouse gases. Decarbonizing health infrastructure by transitioning to clean energy and sustainable supply chains is a crucial step in mitigating the very crisis the sector is desperately trying to treat. Ultimately, however, the primary barrier to global resilience is financial. There is a staggering, unacceptable gap between the desperate need for adaptation in low and middle-income countries and the actual funding currently available on the global stage. While it is true that 95% of nationally determined contributions to the Paris Agreement now officially include health considerations, the actual financial pledges to international adaptation funds have frequently fallen short or faced deeply concerning political pushback. To address this crisis equitably, the global community must fulfill and massively expand its financial commitments. Initiatives like the Multilateral Health and Climate Investment Framework, championed by critical organizations like the Green Climate Fund, the World Health Organization, and various global philanthropies, aim to directly channel necessary funds into urgent health adaptation projects. Crucially, scaling up grant-based climate finance is absolutely essential. Expecting developing nations to take on crippling, high-interest debt to adapt to a global crisis they practically had no hand in creating is both morally indefensible and economically unsustainable. The convergence of climate change, socioeconomics, and geography has created a complex, terrifying web of vulnerability. It threatens to completely undo the last 50 years of hard-won global public health progress. As our planet rapidly approaches critical, irreversible temperature thresholds, the window of opportunity to protect human health is closing faster than many realize. We can no longer afford to treat environmental policy and public health policy as separate, isolated disciplines in government. They are one and the same. Every single fraction of a degree of warming prevented represents millions of lives saved. Every dollar invested today in community resilience is an economic and humanitarian catastrophe averted tomorrow. The defining challenge of our era is not merely stopping the mercury in the thermometer from rising. The true challenge is ensuring that as the world inevitably changes, the fundamental human right to health, safety, and survival is not determined by the geographic latitude of your birth or the size of your wallet. Addressing the climate-driven public health crisis is not just a scientific necessity, it is the ultimate, defining test of our global humanity. Thank you for listening to this deep dive on Fun Facts Online. Stay curious, stay informed, and we will see you next time.